Hello everyone, have you ever noticed a strange, dark patch on your skin or a spot on your leg and just dismissed it? Maybe you thought it was just a sign of aging, a simple rash, or an old bruise that never quite faded. We all do it. We get busy and assume these minor changes are nothing to worry about. But what if I told you that some of these seemingly insignificant spots are actually urgent messages from your body? What if your skin was trying to send you a critical warning sign about dangerously high blood sugar levels? Today we're going to talk about what your skin is trying to tell you about diabetes. I'm going to show you the specific signs, explain how they can appear differently on various skin tones, and tell you what you must do about them. Ignoring these signs is a mistake you cannot afford to make. Hello everyone, I'm Dr. Frank Maxwell, and welcome back to Diabetes Medic. My goal for this channel is to give you clear, science-backed medical knowledge to help you live a healthier, stronger life. Today's topic is incredibly important because your skin is often the very first place that signs of uncontrolled blood sugar or underlying insulin resistance will appear. My promise to you is that by the end of this video, you will be able to identify at least 5 critical diabetic skin signs that are too often ignored. You will understand their direct link to your metabolic health and, most importantly, you will know the exact steps to take to protect yourself. This is knowledge that can save your skin, your limbs, and even your life. Let's get straight into it. Here are the skin signs you should never, ever ignore. Sign number 1, acanthosis nigricans. What it looks like. This is one of the most common signs I see in my practice, and it's a powerful early warning sign. It presents as dark, thick, velvety-feeling patches of skin. It typically appears in the folds and creases of your body, on the back and sides of the neck, under the armpits, and in the groin area. On lighter skin tones, it can be mistaken for a tan or a dirty patch. On darker skin tones, like brown or black skin, it appears as a very dark, sometimes slightly raised, leathery-looking patch. It cannot be scrubbed off. What it means: this is a classic textbook sign of high insulin levels in your blood, which is the hallmark of insulin resistance and prediabetes. When you have an excess of insulin, it can cause your skin cells to multiply abnormally fast, leading to this thickening and darkening. If you see this, your body is sending a clear signal that it's struggling to manage glucose and insulin. What to do? Do not waste your money on expensive scrubs or bleaching creams. This is an internal problem manifesting externally. You need to see your doctor and get your blood sugar and insulin levels tested. The good news is that this sign is often reversible. As you improve your metabolic health through diet and lifestyle changes, these patches can lighten and fade away. Sign number 2, diabetic dermopathy, shin spots. What it looks like. These are faint light brown or sometimes reddish scaly patches, most often found on the shins. They are typically oval or circular and can be mistaken for simple age spots or old faded scars. Because they don't hurt or itch, they are incredibly easy to ignore. What it means. We believe these spots are a form of mild scarring caused by damage to the small blood vessels and capillaries that feed the skin. Chronic high blood sugar weakens these tiny vessels, causing them to leak. This is a direct sign of poor circulation, which is one of the most serious long-term complications of diabetes. What to do? While the spots themselves are harmless and don't require treatment, they are a major red flag about the health of your entire circulatory system. You must show them to your doctor. Their presence indicates that you need to be very diligent with your blood sugar control to prevent more severe vascular problems down the line. Before we continue to the more serious signs, I want to ask you a question. Please be honest and share in the comments. Have you ever noticed one of these dark patches or shin spots on yourself or a family member and simply dismissed it? Your experience could be the wake-up call that someone else in our community needs to see. Sign number 3, fungal and bacterial infections. What it looks like. While anyone can get a skin infection, for someone with uncontrolled diabetes, they can become more frequent, more severe, and much harder to treat. This often presents as very itchy, red, and sometimes moist rashes in skin folds. Under the breasts, in the armpits, between the toes, athlete's foot, and in the groin. You might also experience recurrent bacterial infections like boils, styes on the eyelids, or infections around your nail beds. What it means: high blood sugar creates a perfect storm for infections. First, excess sugar in your system acts as a food source for fungus, like candida and bacteria, helping them thrive. Second, and just as importantly, long-term high blood sugar suppresses your immune system's function, weakening its ability to fight off these invaders. If you're in a constant battle with stubborn skin infections, it's a huge sign that your blood sugar levels may be too high. What to do? Over-the-counter creams might give you temporary relief, but if the infections keep coming back, you are not addressing the root cause. You need to see a doctor to get the appropriate treatment and, crucially, to get your blood sugar under control. Sign number 4, diabetic blisters, bullosis diabeticorum. What it looks like. This sign can be quite startling. A person may suddenly notice one or more blisters, which can be quite large, appearing on their hands, feet, legs, or forearms. They strongly resemble burn blisters, but they appear without any burn or injury and are typically not painful. What it means. The exact cause is still being researched, but it is unequivocally linked to uncontrolled diabetes, often in conjunction with diabetic neuropathy, nerve damage. It's a sign that the disease is progressing and affecting multiple body systems. What to do? It is very important that you do not try to pop or drain these blisters yourself, as this can open the door to a serious secondary infection. They usually heal on their own. However, their appearance is a signal that you must see your doctor immediately. It's a clear indication that your diabetes management plan needs to be reviewed and likely intensified. Sign number 5, diabetic foot ulcers. Now, we must address the most serious sign, the one that carries the risk of amputation if it is ignored. What it looks like. It rarely starts as a large wound. It often begins as something you might dismiss: a small cut, a corn, a callus, or a blister from a pair of shoes. Because of nerve damage from diabetes, neuropathy, there is often little to no pain. This small sore fails to heal. Instead, due to poor circulation and pressure, it breaks down further, becoming an open wound or an ulcer. What it means. This is the devastating result of a triad of diabetic complications. Nerve damage, neuropathy. You don't feel the initial injury, so you don't protect it. Poor circulation, peripheral artery disease. There isn't enough oxygen-rich blood flow to the area to facilitate healing. A compromised immune system. Your body's defenses are too weak to effectively fight off infection in the open wound. An infected, non-healing ulcer is a true medical emergency that can lead to bone infection, gangrene, and ultimately the amputation of a toe, foot, or leg. What you must do. This is not optional. You must practice meticulous daily foot care. Inspect your feet every single day. Use a mirror or ask a family member to help you check the bottoms of your feet. Look for any cuts, sores, blisters, redness, or changes to the skin. Never walk barefoot. Protect your feet from injury, even inside your home. See your doctor or a podiatrist immediately if you find any sore or wound on your foot, no matter how insignificant it seems. Do not wait for it to get better on its own. My final clinical takeaway. Your skin is not just a cosmetic covering, it is a dashboard for your internal health. It is constantly providing you with data. That dark patch on your neck, those spots on your shins, the infection that won't clear up, these are not just skin problems. They are signals of a deeper systemic issue with your metabolic health. Your body is telling you a story. It is asking for your help. Please listen to it. Don't ignore these signs. Don't just cover them up with creams or lotions. Show them to your doctor and take decisive action to get your blood sugar under control. If this information has been valuable to you and you want more practical, evidence-based medical advice, To help you on your health journey, please hit that subscribe button and ring the notification bell. Join the Diabetes Medic community so we can continue to learn and grow together. For today's question, what is one thing you will start doing differently after watching this video? Will you begin checking your feet daily? Or finally make an appointment to get that strange skin patch checked out? Share your commitment in the comments below. Thank you for watching. Now that you can identify these critical warning signs, the next logical step is to understand one of the most common treatments. I highly recommend you watch the video on the screen now. This happens after using metformin for 5 years. It will give you a complete and balanced picture of the medication. Click on it now and I'll see you in the next video.